day, this group of women goes from one slum to the other in South Delhi. Even extreme heat can't keep them from their work.
Rinki, Pinky, Karishma.
They are called ASHA, short for Accredited Social Health Activist, which also means hope in Hindi. Today, an army of over 1 million ASHAs takes care of the health of underprivileged communities.
We've been assigned an area of 400 houses. It has a population of 2,000. We take care of these people, including pregnant women and senior citizens. We do a daily survey in these communities.
Neither doctors nor nurses, this all-women group is the first point of contact for medical care for the poor.
3 kilos.
Launched in 2006, the program aims to make healthcare accessible to India's rural population. Ashas are recruited from local communities and undergo extensive training. They were brought in mainly to curb infant and maternal mortality rates.
The commonest problems are about women being pregnant, being unable to access antenatal care, about newborn children with maybe diarrhea or fever, where the health facility is very far off. So therefore, the idea that ASHA could provide and be sufficiently trained to provide these services was the beginning of inclusion of ASHA in a health system.
India faces an acute shortage of doctors in rural areas where 65% of its population lives, yet employs only 30% of its healthcare workers. On top of that, 2 out of 3 doctors in India don't have any diploma or formal training in medicine. The situation is even worse in the countryside. 1,500 kilometers southeast of New Delhi lies Odisha, one of the poorest states in the country. Mathilda Kullu, an ASHA worker for 16 years, belongs to the first batch of recruits. She helps over 1,000 families in this area. As part of Mathilda's duties, she makes sure sick people follow their prescribed medication. This morning, she's here to check on this man suffering from leprosy.
Show me, has the swelling decreased now?
I've been told to take my medicine for a year.
Yes, for a year, and don't even stop it for a single day. He's better now. It's his first month on medicine. I'm here to ensure he's taking it the right way. If he makes any mistakes, then I have to advise him. I also told him not to drink alcohol, otherwise the medicine won't be effective.
Mathilda is a lifeline to the villagers, but winning their trust was not an easy journey.
They didn't know about the facilities available in hospitals and why they should go there. They used to say, I want to give birth at home, but now hospitals account for 100% of all deliveries. Earlier, people were misinformed and they self-medicated, but that's stopped. Now they visit the hospital and only after checkups, they take their medicine. Also, ASHA workers have to be mindful of how to talk to people of other castes. Sometimes people say, don't sit close to me, to lower caste ASHA workers. They're very casteist.
Over the years, the duties of ASHA workers have been expanded to include family planning, eradication of polio and tuberculosis, and immunization campaigns. And when the pandemic hit, they were at the forefront.
We'll arrange the vaccination here, so do come.
When do we have to take the booster dose? After 9 months?
Yes, 9 months after the second dose.
But now, Mathilda and thousands of her colleagues are fighting another battle. For months, they have been protesting against their low wage and employment status. According to the Indian government, they are volunteers, so they get only a small compensation. They are paid between 40 and 100 euros a month depending on the state.
During the corona period, all of us were applauded. The government said we did remarkable work. People were asked to clap for us. We were given flowers and garlands. But that's not enough. We have families to feed. We deserve a minimum wage. We should be recognized as workers. We should be enrolled in the pension program and have social security.
Their hard work was honored by the WHO in May with the Global Health Leaders Awards, a long overdue recognition for these women who are caring for millions of poor people.